Hello, and thank you for joining today's webinar, Overview of the State MMA File to CMS for Dually Eligible Individuals. This is Linda King in the Medicare/Medicaid Coordination Office, or MMCO. This covers CMS's strategic priority, what is MMCO, who are dually eligible individuals, why is the MMA file so important, and an overview of the MMA file. CMS Better Care for Dual Eligible Individuals is one of the administrator's 6 strategic initiatives. The goal is to improve quality, reduce costs, and improve the customer experience for people dually eligible for the Medicare and Medicaid programs by modernizing the Medicare Savings Program, which includes the CMS State Data Exchange, crossover payments, and reducing burden in eligibility processes. The MMA file is a key factor in improving administrative efficiencies under this strategic priority. The file was highlighted in the December 2018 State Medicaid Director's Letter, 10 Opportunities to Better Serve Individuals Dually Eligible for Medicaid and Medicare. MMCO's role brings together Medicare and Medicaid in order to more effectively integrate benefits and improve the coordination between the federal government and states to enhance access to quality services for individuals who are enrolled in both programs. There are 12 million individuals that are simultaneously enrolled in Medicare and Medicaid. They are low income and are either over 65 and/or have significant disabilities. They have high rates of chronic illness, with many having long-term care needs and social risk factors. 41% have at least one mental health diagnosis. 49% receive long-term care services and supports. 60% have multiple chronic conditions, and 17% report that they have poor health status. This is compared to 6% of other Medicare beneficiaries. There are 2 main subcategories of dual eligibility. 71% are full benefit dually eligible beneficiaries. They are enrolled in Medicare Parts A and/or B and receive full Medicaid benefits. 29% are partial benefit dually eligible beneficiaries. They are enrolled in Medicare Parts A and/or B, but Medicaid only helps them pay for Medicare premiums and often cost sharing. They have to navigate 2 separate programs: Medicare for the coverage of most preventive, primary, and acute health care services and prescription drugs, and Medicaid for the coverage of LTSS, certain behavioral health services, and Medicare premiums and cost sharing. Since 2005, states have been submitting files at least monthly to CMS to identify all dually eligible beneficiaries. The file includes full benefit dual eligible beneficiaries and partial benefit dual eligible beneficiaries. The file is called the MMA file after the Medicare Prescription Drug Improvement and Modernization Act of 2003, but is occasionally referred to as the state phase-down file. Even though states are required to submit at least monthly, some states submit multiple files. This gives the states the opportunity to provide current information on updated dual eligible status. The state would submit one complete monthly file, and subsequent files would include only file accretions and deletions. The state has until the last day of the month to submit a file. The MMA file provides CMS with the best source of comprehensive, contemporary, and updated dual status data, which we use to help make certain Medicare benefits accessible and affordable for dually eligible individuals. The file supports CMS program needs to auto and facilitate enrollment of dual-eligible beneficiaries into Medicare drug plans, deem dual-eligible beneficiaries automatically eligible for the Medicare Part D low-income subsidy. This includes full premium subsidy, zero deductible, and copayment that varies according to type of dual and institutional HCBS status. Determine monthly phase-down payment amounts due from states. The monthly payment is based on a count of all full duals made by each state to the federal Medicare program to support the Medicare drug benefit that began in 2006. Risk-adjust capitation payments to Medicare Advantage plans for dually eligible enrollees, and in Original Medicare, identify qualified Medicare beneficiary status to alert those individuals and the providers who serve them that they are not liable for Medicare A/B cost sharing, and lastly, conduct analytics and support data sharing. MMCO is the agency lead and business owner for the MMA file. We also partner with the Office of Financial Management, who bills states each month for phase-down payments. The Center for Medicare Division of Medicare Enrollment Coordination, who is the business owner of the Medicare Beneficiary Database. The Office of Information Technology is the technical lead for the MBD and verifies the enrollment counts OFM uses for state phase-down billing. The Center for Medicaid and CHIP Services Data and Systems Group, the IT Medicaid Enterprise Systems state leads, assists with communicating system and operational changes to states. Finally, Northrop Grumman, the technical contractor for the MBD. This next slide gives an overview of the file process. The state submits a request file to CMS. This is the state's opportunity to provide current information on updated dual eligibility status. For each request file the state submits to CMS, a response file is generated. The enrollment data is matched from the beneficiary's request file record in the MBD, and from this, a response file is generated and sent to the state within 24 hours. Data matching is based on the Medicare identifiers such as the MBI, HICN, or SSN, the date of birth, gender, last name, first letter of first name. Medicare, Medicaid enrollees are typically classified according to their benefits that they are eligible to receive according to their income and assets at any given point in time. Enrollees are classified by a dual status code that indicates whether they are full dual or a partial dual. There are 8 dual status codes. There is a link to the full document of dual status codes at the top of the slide. Here's an example of a dual status code. Dual status code 01 is for a partial benefit. Qualified Medicare beneficiaries without other Medicaid, also known as QMB only. These individuals are entitled to Medicare Part A, have income of 100% federal poverty level or less, and resources that do not exceed twice the limit for SSI eligibility and are not otherwise eligible for full Medicaid. Medicaid pays their Medicare Part A premiums, if any, Medicare Part B premiums, and to the extent consistent with the Medicaid state plan, Medicare deductible and coinsurance for Medicare services provided by Medicare providers. One of the key fields on the MMA file is the institutional status indicator, which indicates that a full benefit dual eligible receives Medicaid-covered nursing facility, inpatient psychiatric hospital, or home and community-based services. The field is key in establishing zero copayments in Part D for full benefit dually eligible beneficiaries. The following field values trigger zero copayment level. A Y indicates that a full benefit dual eligible beneficiary is enrolled in a Medicaid paid institution for the full reporting month or is projected by the state to remain in the institution for the remainder of the month. H indicates that a full benefit dual eligible beneficiary receives HCBS. This applies to most but not all HCBS programs. There are a few other key fields I'd like to bring to your attention. The state submits a detailed record for an individual having both Medicare and Medicaid in the current month. An example of what is included on a detailed record: eligibility and enrollment, gender, date of birth, and dual status code. The retroactive detailed record: the state submits a full person month record to report information on changes in circumstances for a beneficiary that were effective in a prior month. An example: a beneficiary not previously reported who was determined by the state to be retroactively eligible 3 months prior to the reporting month of April 2019. The state must submit a detailed record during the month of April for the eligibility month year of April 2019, as well as a detailed record for the previous 3 months, January, February, and March 2019. The state submits a prospective record for an individual in the Medicaid program who is not known to be eligible for Medicare. States only submit a prospective record for individuals who, if they have Medicare coverage, would be full dual eligible. An example: an individual that is approaching the age of 64 years and 7 months or older in the reporting month. The prospective record allows CMS to set up subsidy status and auto-enroll beneficiaries into a Part D plan so their coverage will be in place when they become Part D eligible. The MMA response file was originally used to support Part D operations. It is now used to support operations and to send to states a rich array of A, B, C, D Medicare enrollment and eligibility data. The file also contains data pertaining to Comprehensive Addiction and Recovery Act status periods, ESRD clinical dialysis dates, hospice coverage, managed care enrollments, Medicare plan ineligibility due to incarceration, plan benefit package enrollment. MMCO has been collaborating with our CMS partners to improve the MMA file data exchange. In November 2017, we began efforts to have states submit files more frequently, and this spring implemented a plan to monitor the data quality. States are required to submit at least monthly, but the lag between monthly submissions causes burdens for providers and beneficiaries. Changes can occur to eligibility at any time. Let's say, for an example, that the state of Maryland submits a June monthly file for the first of the month. Mr. Jones' eligibility changes on June 14th. This change would not update in the CMS systems until the July monthly file is submitted. Claims are processed and paid in error by the state, and efforts must be made to recoup payments from providers. We found that more frequent file submissions promote administrative efficiencies while also benefiting dual eligible beneficiaries and providers. Please check out the link below to read more about the benefits of more frequent data exchanges. Currently, 11 states submit data files monthly, 24 states and DC submit weekly, 15 states submit daily. In the interoperability NPRM, CMS is proposing to update the frequency requirement to require that starting April 1st, 2022, all states submit the required MMA file data to CMS daily. We continue to monitor and validate data submitted by working with states that self-report issues, Review and analyze data trends over time to identify and follow up with states on any anomalies. And starting in July, MMCO will receive monthly reports to monitor and validate data submitted on files. Any unexpected shifts in data will prompt outreach to states to identify and resolve root cause. We will continue to provide trainings to CMS staff and states and their MMIS vendors on the MMA file. That concludes the presentation. Should you have any questions, please direct them to mmco_MMA@cms.hhs.gov. Thank you very much.